Hello, and as always, thank you for watching us here at Palos Heights Community Channel 4. My name is Carol Steffen, and I'm camera with Carl Gurman. We've been invited into a chiropractic practice here in Harlem Avenue here in Palos Heights, and the address is 12413 South Harlem. And I'm here with Dr. Ronald Lucas, who is the chiropractor who practices here in 12413 South Harlem. Anyway, thank you for inviting us in, Doctor. We're invited to come in and talk with you. The practice of chiropractic practice has changed so much over the years that I've been aware of it. You know, people used to be just coming in for a bad back. Tell me how your practice has expanded over the years and changed.
Well, our practice is basically three-pronged. The first one is we deal with primarily people that have post-surgical back problems. So these are people that have had one or more lower back or neck surgeries. They're still having problems, and we can help those people. The other portion of our chiropractic practice is that we deal with people that have chronic disc problems in their backs and necks, and we can get very good results in those departments. The next phase of our practice is what is called enzymatic nutrition, and nutrition is a very, very big field, but we specifically concentrate in the enzymatic function of the body. Most people have problems with digesting carbohydrate, fat, or protein. They don't know it, and subsequent to those problems, they develop all kinds of symptoms that they go to multiple doctors for, have multiple treatments for, and they never really get down to the cause of the problem. So fat, carbohydrate, and protein digestion is critical for your health.
Okay, the third?
Okay, the third prong of our practice is we do a diet that consists of it's a 42-day program. The average female is going to lose 23.5 pounds of fat in 42 days, and the average male is going to lose 30 pounds of fat. And fat is a real big issue for people because of what is called body mass index. Body mass index has to do with your height and your weight. It has nothing to do with your age. And the new healthcare laws are going to take the body mass index into effect big time. So it's very, very important that people keep their weight down as much as possible. The other problem with the weight is we see people going into what is called metabolic syndrome. It has to do with three things: being overweight, diabetes, and hypertension. So these are big problems in society, and we try to help people get through these problems.
You absolutely amaze me. I had no idea that you covered that type of a field in the chiropractic practice. Today's world, with the problem with obesity, is a worldwide problem, and it's kind of your practice. They must be pounding down your door, you know, with people coming in to address these problems. So it's not just diet.
No. Again, if we go back to the enzymatic nutrition, enzymes are the most critical component of your body. In fact, the DNA structure in your body, 80% of your DNA is coded to produce enzymes. So enzymes are super, super important for the body, and most people are very, very deficient in enzymes.
Well, this is really an education process, isn't it? As far as letting the population and people know that, you know, you don't have a stomachache all your life because you might have an ulcer, you might something else, that there could be an ulcer, really a basic problem there that you could control.
Correct. And our view on it is we want to get the person back to health as much as possible without the use of pharmaceuticals, if it is possible. And so that's our general idea.
So really the basic thing is education. People need to know that they're able to take ownership of their own health and take steps forwards to correct what the problem is.
Absolutely.
But that's a part of letting people know. Are you available? Do you go to programs? Do you educate people?
We do. And I'm available to do that for any group that is willing to
I
have
would think
me.
that would be a basic block, building block for any chiropractic practice, is to educate people as
Yes,
to what the
yes.
need is, that they can take ownership.
Absolutely.
Who
Absolutely.
would be your typical patient?
A typical patient is usually female, 30 to 60 years old. They have a back, they come in initially for a back problem, and then through our history and examination process, we find out that they have multiple problems going on. And a lot of times the back problem is the end result of, let's say, a nutritional problem.
Really?
And that's a real big one, especially protein digestion problems. Most females have problems digesting protein and fat. And the problem with that is once the body becomes protein deficient, the body has to get the protein from somewhere, and it gets it from catabolizing or breaking down the body itself. So the body has to take the protein out of itself to make the blood appear normal. And that's the problem with blood work. You can be very, very sick, and your blood work comes back normal.
Really?
We hear this all the time. People go to doctors. They say, "Look at my blood work. It's all normal. I feel terrible. Why is that?" So these are the kind of problems that we deal with, and we're very effective at dealing with them.
Now, does this take years to build up? I mean, are you older, are you middle-aged by the time this manifests itself in your body?
This can manifest itself in your body at very, very young ages. You can be an adolescent and have major, major problems in the digestion department.
Is it a heredity type of thing?
It could be, but most people have a proclivity in digestion. For the females, it's primarily protein and fat.
Really? Are your services covered by insurance?
Some of them are, and some of them aren't. It just
Okay.
depends.
Okay, so it depends. So coming
Right.
in and finding out would be the
Right,
would the
right. We would verify your insurances
Okay.
and tell you upfront everything.
Okay, okay. It's so interesting because I thought when I prepared for this interview, I would come in and be talking about skeletal problems. Because I'm looking around and I'm looking kids getting ready for school. I have grandchildren that are getting ready to school, and their book bags, which is always such a problem with me watching these kids put 50 pounds of books in their book bags. Have you seen more young people coming in because of this weight that they're carrying around all the time?
Well, the young people that we see, again, they're primarily for digestive problems.
Really?
Because the parent gets a result, and they bring the child in for those reasons. A lot of intractable back problems have to do with digestion problems. It could be liver, spleen, kidney issues, you name it.
This is an amazing, enlightening thing for me. When you first went into this field, were you amazed over the years how much it's changed and how much it's opened up as far as the need for you?
Well, the problem is that the medical models, a lot of them just don't work for people, and they need an alternative. You know, and medicine is necessary. Don't get me wrong, but there's a lot of people that just fall through the cracks, and they're looking for answers, and they're looking for a different way. And that's kind of where I fit into.
It's you've taken me by surprise with this interview. I thought maybe we'd be talking about the sedentary lifestyle that I'm seeing going on, and people just locked into their computers and back problems. And so you've taken me down a different road. It's been very interesting.
Right. That's the road that we go down because we have to. When a person comes here, we have to get results. And if someone comes in with a lower back problem, and we examine them and we find that it's really not. That is not the primary problem, then we have to treat the primary problem to get a result for that patient.
Okay, so you're really treating a symptom, but there's more to it than just that symptom. There's a basic need that needs to be addressed.
Correct. And there's some people that have primarily just back structural issues, and we'll treat them in a structural standpoint. But if they have chemical issues, again, protein, carbohydrate, fat problems, it behooves me to help them in that department.
And do you suggest like different vitamins or minerals or things to add, supplement to their diets?
Well, we don't give vitamins and minerals per se. All of our products that we give people are considered foods by the body. So a food is something that has protein, carbohydrate, fat, vitamins, minerals, and enzymes in it. If I give somebody a 500 milligram vitamin C, the body is going to look at that as a drug. It is not going to look at that as a food.
Okay.
So it's going to go anti to what we really want to accomplish. We want to treat the person with things that the body is going to see as a food, so the liver doesn't have to go through multiple phases of detoxification of these products that are not considered foods. So if we go back to the vitamin C, the 500 milligram vitamin C, if you take a 500 milligram vitamin C, the body really looks at that as a drug, not a food.
Okay.
Because it does not meet the definition of a food.
Okay. If people wanted to come in and talk with you and find out more about this and perhaps become interested and come to you more frequently as a patient, how would we reach you? Tell me your address, the hours that you're open, and your phone number.
We're located at 12413 South Harlem, Palos Heights, Illinois, basically 124th in Harlem. Our website is lucaschiro.com. The address, I did that already.
Yeah, that's okay. Basically, where you're located is right behind Looms. They're on the west side of the street, right behind Looms Restaurant. So that's a good way to, kind of a milestone to peg it next to. But tell me your hours.
The hours are Monday, Wednesday, and Thursday from 9 to 6, Tuesday from 2 to 6, and Saturday from 8 to 11.
And your phone number.
Phone number is 708-361-5455.
If you found this interview as interesting as I have, please contact Dr. Lucas and find out more about whether this might be something that you'd be more interested in finding out about for your own problems. It's so common to talk about digestive problems. Everybody seems to have them in some fashion, especially with all the fast foods and things that are just so easy with the lifestyle that we're all leading. We're all on the run all the time with ourselves, our children, our grandchildren, or whatever. So it might be something to research a little further. Certainly your call. In walking through your offices, doctor, I noticed that you have tennis shoe up on display with an orthotic below. In being a former tennis player and had worn orthotics, tell me the benefit of that, or how would you lead to go into that field?
A lot of people come in, again, with a lower back pain. It's very, very important to check the leg lengths on people. Most practitioners do not do this, and it's a big thing that people miss when they evaluate patients. So it's very, very important to get the person, especially their femur heads, level to the ground as much as possible. If that does not happen, leg length problems are the genesis of a lot of hip and knee replacements as people get older.
Really? So if that had been taken care of, possibly you would need hip or knee replacements?
You could need it or slow down the progression of that problem.
If I'm walking along and there's no noticeable limp, could there still be a leg length problem?
Absolutely, absolutely. I mean, you can be off over an inch and have no noticeable limp because of compensations that the body gives the person.
Really?
Absolutely.
Well, that's interesting.
Yes, yeah.
I keep learning new pieces of knowledge in this interview. Thank you for talking with us, Dr. Lucas. I've enjoyed the interview. I've learned a lot of new things and things to ponder and think about. And again, thank you for inviting us in.
Thank you.
And as always, thank you for inviting us into your homes.